SCK Madeline began as a school called Madeline Fosbach Academy, and the founder was Daniel Fosbach and the wife Madeline. They saw the need to reach out to the child in this community. It began in 2006-2007 with a total of 170 children and 9 teachers. It operated at the rental shop at the Mechmeru Shopping Center. And in 2008, the project relocated to where it is right now in Sango Village. This is after the founder acquired land, 5 acres of land where the school lies. In 2016, it's when the founder handed over the project to the SCK Diocese of Bungoma, and teachers started getting salaries through Yatima Outreach. And as a way of motivating them, that was something that retained most of the staff.
Yatima engaged in partnership several years back through SCK Church, Diocese of Bungoma. Through the church, we were able to partner, come in and support through infrastructure development, and also just to ensure the vision of the founders is aligned to the mission, the goal.
The population of our SCK Madeline Fosbach Academy currently is at 328. In 2016, they started offering health services to the children of the program. And we had a security booth that served as a clinic for the center where children were treated and they will attend classes. Yatima has really supported this project, especially when it comes to structures. And now we have a clinic structure in place. And the classrooms at that time, they were muddy ones and with earthen floor. And you can imagine the health hazards that our children were being exposed to.
Our journey with KCDF began way back in 2023. Of course, we had this big need that women of childbearing age used to lose children on their way to the only government-owned facility in the area, which is Mechimeru Dispensary. So the dispensary lacked staffs, it lacked resources and equipment to support these people. And also the community needs were growing over time because it was only one facility, so it could not be able to serve the needs of those people.
We've had over 180 successful deliveries in the facility. When that feedback came, that it's a grand matching, we had to do some meetings with the parents during school meetings. Actually, it was our first time ever to do a fundraising in this place.
We're able to mobilize the community, we're able to mobilize our partners from the Ministry of Health, other NGOs, local businesses. We also did personal solicitation as a strategy where we visited various organizations, institutions, including banks, who were able to come on board to help us do the fundraising.
KCDF's main role is to incentivize them to be able to raise their 50%. And we do that by committing to match their contribution of the 50%. Besides that, our biggest mandate is to strengthen their capacity to be able to achieve. And that is where we bring in the bit of the coaching, the bit of the support, the bit of the encouragement, just supporting them to ensure that they are able to meet their targets.
When implementing Pamoja for Change, you have to keep on going to the essence of that name, which means Pamoja together. And so as KCDF, we look at the community or the organization that is hosting that particular intervention as the owner of that initiative. And so what we do is work with them to either through exchanges, peer learning, sometimes even inspiring, sitting with the leadership and just inspiring them, sometimes, ensuring that they have the capability, tools, tactics, attitude to raise resources. And in doing so, then they are forced, or they will find relevance in attracting other actors.
Some of the community members were not able to give cash, but they were able to give donations in kind, in form of beans, in form of maize. And since we have a school feeding program, we were able to sell all those proceeds to the feeding program, and the money that we got from that was channeled towards the fundraising. The first funding came in 2024, and that's where we launched the MCH wing around February of 2024, and we've supported over 180 something mothers through the MCH wing, and we've had over 180 something successful deliveries. In phase 1, we were able to equip, because the facility didn't have the medical equipment to set up the MCH wing. We also did a placenta pit, which is a requirement by the Ministry of Health. And we were able to also bring on board additional health personnel who have been able to provide services to the patients that we serve in the facility.
Nilikuwa naenda hospitali mahali fulani, na ukifika kule daktari hawakuhudumia haraka. Mwishowe nikapoteza ujauzito wangu. I had a miscarriage. Nilipokuwa nikienda kule, distance ya kufika kule hospitali ilikuwa mbali, lakini walipoleta hii hospitali hapa ni karibu, na ukifika wanakuhudumia kwa wakati.
Wanawake walikuwa most of the time wanasafa kwa maybe wanaweza enda daktari maybe amechoka amjibu vibaya, juu sasa ameshughulikia haraka, unapata huyo mama amepoteza mtoto. Nikianza kliniki hapa mahali nilianza nikiwa 6 weeks, na nilikuwa na shida ya ovarian cyst, na daktari wakakuwa karibu na mimi from the start mpaka venye nilijifungua.
Previously, wamama walikuwa wananiamusha usiku, even saa 6 ya usiku tuende hosi. Mama angesalia njiani na mpaka tuandamane na yeye mpaka hospitali. Lakini vile hii hospitali iliingia hapa, it saved me a lot. Saizi hata wakiniamusha saa 8 ya usiku, saa 7, nitapikia daktari kwa sababu niko na namba zake, nitamuamusha na tukuje tusaidiane.
This is the only facility, the health facility that we have in this area. And when they come in, you cannot tell them go away because of the facility is small. You have to get a way of helping them.
I welcome you, and I'll take you through our service delivery points so that you know what we offer as a facility. This is our waiting bay where we receive our patients. This is our pharmacy where we dispense our medicines. This is our consultation room where consultation services are being done. And behind us we have a procedure room. In case the patient needs any procedure, we do it from there. This is our delivery room where the deliveries are being done. And actually this one is among the infrastructure improvement that was done with KCDF. And here is our child welfare clinic. All immunization for our kids are being done at this place. And now inside here is our antenatal clinic. Here we have an ultrasound machine. It is an essential tool that has helped us doing scans and screening for the mothers and help in management of labor and also the planning of their deliveries. It is one of the machines that also was bought through the KCDF partnership. Inside here, we have an empty space. This was expanded to allow us accommodate more beds. Now, as you see it, it is empty and we need support at least to acquire beds and accessories for the wards.
So this is our lab setup. Through the support of KCDF and partnership with Yatima Outreach, we were able to acquire machines like RBS machine. Then we also have HB machine. We were able to acquire a fridge. A refrigerator is used to store laboratory reagents. Then we have the shaker rotator. We also got a centrifuge. A centrifuge is a machine used to separate blood components. We also got a dryer, which is a swag instead of waiting for the malaria slide to air dry. We also got a microscope. Microscope mostly is used in diagnosing malaria. It also does urine analysis, microscopy. We also do stool analysis using the microscope. We also got it from the support. Then we have a full hemogram machine. It analyzes all the blood components, the white blood cells, red blood cells, and platelets.
That image, the buildings itself, it portrays a good image of the community, and also the service delivery. We have so many people around who are now opting at the SK Mad Line, leaving out the public facility. Why? Because of the service delivery at the facility.
KCDF has really supported in terms of capacity building of staffs. Just recently, we had a training on fundraising, local fundraising, since our needs keep on growing and we know the funds that we have currently may not be enough. So we intend to use the skills we've acquired to reach out to even more partners. The skills have also helped us to improve in our normal daily operations. For instance, we've been able to update our procurement policy just because of the skills that we had. Data protection policy has also been updated. Initially, we actually didn't have. This has also helped our staff to be able to meet the government regulatory requirements, especially the pieces that were initially missing.
Nashukuru sana Yatima Outreach na KCDF kwa kuleta hapa huduma. Asante sana kwa kazi yao nzuri. Wametuwezesha kama mimi mama mmoja wao kupata mtoto na wana huduma ulio bora zaidi hapo.
Alafu at least watupe ambulance.
Earlier on, the maternity wing, we had 7 beds, of which for the maternity to work and sharp payment to be generated to the hospital, it was communicated that the facility must have 16 beds. The extension of the maternity, when it is well equipped, the facility accommodate a good number. It also be good if we'll have an ambulance at the facility, and we have those one who opt out for CS, we have those one who opt out for normal deliveries. So we'll also have that need of CS, most of CS to be operated at this point.
Looking ahead, we are thinking of expanding the clinic to even reach more people. This will be through looking for more funds, of course, to have a higher bed capacity, so that way we'll be able to reach a wider magnitude of people within the area. And then we're also looking forward to have staff quarters, because one of the challenges we've had as a health facility within this area is that staffs stay far from the facility, and some of the medical needs sometimes are emergency cases. So if a staff live far from the facility and we have an emergency case, for them to reach here, it becomes a challenge.
One day, someday, SCK Dr. Pike Roper will be a big hospital in this region.
To KCDF, you've really supported growth in terms of the health facility. We can only say the transformation has been magnitude, it's visible, it's felt, and this has also increased the number of patients who are coming on board for our services. The other thing that we would really want to appreciate KCDF for is the fact that now we have an ultrasound machine. We are able to detect complexity of a gravid mother on time and do the necessary health referrals before it's too late. So we can say that has also helped in terms of reducing the rate of maternal mortality. So KCDF has helped us to transform this area in terms of health services.